This is Dr. John Campbell, a highly respected medical professional of 30-40 years who is frustrated for one of the first times ever. He is angry. I want you to help him. I want you to listen and help him because he has discovered something very wrong indeed. Very simply, this is how to give a vaccine without going into the blood supply and endangering lives. It's simply the method. And unfortunately, as he points out, the CDC, the WHO, Public Health England, NHS, the UK, the US, and other countries globally are putting lives at risk because of wrong administration techniques.
So I've got this letter. This letter here is from my MP. Kindly passed it on. Dear John, writing back to me, thank you for your correspondence, etc. Has passed it on to various people. And anyway, this letter ended up with Nadeem Zahawi, the vaccine minister. That's where it ended up. And he basically says I've nothing to worry about. So here we go. From the reports of major thrombosis and concurrent thrombocytopenia, and this was back in the day talking about the. This is when I first wrote in about the adenovirus vector vaccines, but we now know the same is true for the messenger RNA vaccines. We've not been able to identify any evidence of association with errors in administration in the UK cases. Well, of course you're not, because if you get it wrong, you don't know, because you stick the needle in, you inject it, and you pull the needle out, and you haven't got a clue. Let me say that again. You haven't got a clue whether it's gone into a muscle or a vein. So of course you don't know if you've got it wrong. It's not as if you say, oops, got that one wrong, better go and report that. No, you would simply never know. So this is just poppycock, what Nadeem Zahawi's person has written here. It's just... Guidelines published from Public Health England states there is no need to pull back on the plunger, aspirate before the plunger is depressed to release the vaccine into the muscle. Well, hopefully into the muscle, because there are no large blood vessels at the recommended injection site. Now, this just beggars credulity. Let me just tell you what they've said here. Basically, they've said that this muscle, there's no blood vessels going to this muscle. It doesn't have a blood supply. Now, if you get an elastic band and tie it around your finger and cut off the blood supply, it'll go red, it'll go white, then red, then it'll go mottled, then it'll go purple, then after a few days it'll turn black, and then it'll drop off. It'll die. It's called necrosis. You know, the idea that a minister of the realm is writing to me saying that there's no significant blood vessels in a muscle. It's just unbelievable. A muscle is a living tissue, therefore it's got a good blood supply. I mean, why don't these people realise that? You understand this, and most of you aren't clinicians. No, why don't they get this? It's just, if you can think of something to do, please do, because, I mean, why don't we do it properly? Right, anything you can think of to rectify the situation. The references are there in the description. If you know anyone in power, get them to change the policy so we stick the needle in, draw back. If there's no blood, then we inject, keeping the needle in exactly the same position. So you stick it in, you hold it where it is so the needle's not going forward or back. You aspirate. If there's no blood, then you inject it with the needle not going forward or back. And what I do is I'll just stick the needle in like that. I'll stick it in, and then I'll hold my fingers just against the patient's skin to keep it in just the right position. And I've taught student nurses to do that using that exact technique for well over 30 years. And now the CDC, WHO and Public Health England say you don't need to bother doing it. If you can think of anything, please do. Thank you for listening.